Good afternoon, good morning, good evening, depending on where you are. This tumultuous moment in United States history and global history through the persistent pandemic that keeps surging and in ways that are disrupting life worldwide still. The vaccines have come along incredibly rapidly, but the rollout of those vaccines is a huge part of the story now. It's kind of this Act 2 or Act 3. And it's being mishandled quite often by the press, not just here, but in other countries. We do that thing we do, which is focus on outliers, focus on the dramatic. That old nostrum, if it bleeds, it leads, tends to get in the way of really correct portrayal of these issues. Today, I'm going to discuss the options, both the issues and the options related to vaccine coverage. I'm Andy Revkin at the Earth Institute, Columbia University. Although I'm in our Hudson Valley bureau, essentially my tiny little bedroom here. And it's wonderful to have Maren McKenna back, who's an author and a longtime health-focused writer with a couple of books on aspects of pandemic risk. Been on here before, just a few weeks ago, talking about one aspect of the same issue.
And reporting in from the Atlanta bureau, where we all had a very late night last night.
Yes, indeed, as was the case here too. And it's still, I was watching a little bit of President Trump, his last super spreader event, perhaps, at least as president in Washington, D.C. And also with us is Jessica Malati Rivera, who is the communication lead for one of my favorite journalism projects that emerged out of this insane year last year, the COVID-19 tracking project, created initially by a couple of people at the Atlantic, now with a lot of partners. And it's great to have you here to talk through some of this. You have a background in epidemiology and infectious disease transmission biology and communication. So there's lots to talk about. How are you both doing, first of all, besides tired?
You took it out of my mouth. I'm tired.
Yeah, what a time.
Yeah.
And Maren, again, we just had you on just before the turn of the year, I think, talking about
moments ago.
You had a story. You had a story in Wired. It was not so much focused on journalism, but on the general issue of getting vaccine communication right early on, which should have been, of course, months and months and months ago. But here we are, where we are, and we've had these situations percolate the last few days, few weeks, even. This show came around because Erin Cassani, I think it's Cassani, a colleague of Jessica, through this tweet just before New Year's, I think a cross newsroom guide to accurately and responsibly communicating vaccine news would be useful. It might prevent a lot more of the unhelpful coverage discussed here. And that unhelpful coverage was a Reuters story and other related work showing where there was, I think, a doctor in one case, a nurse in another. And lo and behold, they had symptoms after taking a shot. And the headlines were horrifically bad because they kind of portrayed the worst possible way of the story. You both have been very active on social media as well as in the media generally. Here was Maren back in mid-December when your piece came out in Wired. The chances are very good that whenever you get the COVID vaccine, you'll be down for a couple of days with fever, fatigue, and aches. This is normal. We are very late in telling people what to expect. Alarmists and bad actors are going to fill the void. And there was this other more stark failure in Wisconsin a few days ago that Jessica got at. But Maren, let's start with you on this. Is one of the bad actors the media? You know, we know about the active disinformers and idiots out there, but when we have those habits, you know, I was in newsrooms, New York Times news reporter for 15 years and a blogger for more. And the intensity and the clickable sense of what's successful still dominates, and you're getting that headline out there right away. So are we like part of the problem, and what we'll talk about, you know, can we be part of the solution?
Yeah, we're part of the problem. Of course we are. Because, as you say, we have always, I mean, we institutionally, and this has only been reinforced by social media, you know, we are in search of traffic and in search of eyeballs, because that's our business model. And so anything that is new and hot and extreme and out of the ordinary, we are naturally going to cover it. Now, that in itself is that's not so much a failing, that's just kind of baked into the media. But what we persistently, I think, fail to do is contextualize. And in the stuff we were talking, that you're showing in this tweet that you're showing of mine, a story of mine from the close to the end of the year, and even more so since, in the couple of weeks since, that feels again like a century, we have been reporting the newest thing, the variants in the UK, the variants in South Africa, the question of, are these more transmissible, and what exactly does more transmissible mean? What's the mechanism? As though all of these are the first story ever, without any background, or at least with, in my view, insufficient background contextualization. Now, that said, one of the problems all through this past year has been that when we get too far out in front of ourselves by being over what appears to be overly alarmist, particularly to someone coming to the story new, and amazingly, there still are people coming to the story new, we rely on the experts to kind of provide the background contextualization for us. But a lot of the voices who would normally do that over this past year have had trouble getting their message out there, in some cases like the CDC, because they were actively squashed by the outgoing administration. That's clearly changing now. The CDC gave a briefing just earlier this morning, an hour or two ago. So maybe this sense of like who speaks for the less hot news, for context, maybe that's going to change. But in my view, there's been a real imbalance. So I'm doing that thing that I always tell my students to do, of like, listen to the fact that people say everything twice, that I'm now saying things twice.
Right.
So I will say it twice one more time. I mean, yeah, we are at fault. Some members of the media more than others, and some social media commentators more than others. But the forces that would normally pull us back from that have had trouble getting their voices out there as well.
Sure seems that way. And Jessica, just give us a thumbnail sketch of your background and what brought you into this arena of communicating pandemic risk and the relationship with COVID-19 tracking project.
My background is in public health and in infectious diseases. I studied epi and public health as an undergrad, and then in graduate school, I studied emerging infectious diseases and worked with a project on detecting new outbreaks. We were detecting the emergence of new pathogens in plants and animals and humans, and basically trying to predict the next pandemic, because it was a matter of when, not if. Right. So we are very much living the scenario in which I was preparing for and having nightmares about 10 years ago at Georgetown. And in that process kind of became a science communicator, because what our job was to do, we were translating data and information from sources all over the world in 50 different languages, and making it so that our users, which were primarily federal government teams, we were translating it to make it accessible so that they can make conclusions that were based on actual data and not anything hyperbolic or dramatic. And making that accessible to wide audiences became a passion of mine, because I was seeing so many incorrect conclusions from dramatic headlines. Sorry, I have so many notifications right now.
That's okay.
Turn that off. Did that for a number of years. And after that project sadly was defunded, because we've systematically seen the devaluation of public health and particularly pandemic surveillance and preparedness. I started working mostly on vaccine preventable illness education. So a lot of pediatric vaccine stuff, a lot of making sure that misinformation and disinformation about vaccines was, staying off the internet, or if it was on the internet, doing as much myth busting and debunking as possible. So when COVID-19 emerged, it was kind of all of the things from my background combined together, and got connected with the COVID tracking project by literally reaching out to Alexis Madrigal on DM via Twitter. Yeah. And been working with them to help make sense of the chaos, make sense of the data, make sense of the science behind the data, so that, because, we have seen, all of us have seen charts and headlines completely misconstrue the narrative. We are trying our best to make sure that that doesn't happen, and that people aren't misrepresenting or manipulating the numbers and charts. Yeah,
I won't hide the fact that a couple of months ago, I pushed on Twitter, for what it's worth, that there's an evolving sense of what public service is in journalism. used to be you'd write a 3-part series and someone would get fired or politician would have, be impeached. And that's definitely part of public service journalism. But now I think what the Atlantic did, what Alexis and Rob Meyer did, and everyone else jumped onto there really early in the game.
Yeah.
I said it deserves to be up for the Pulitzer for public service journalism because it's actually a new relationship with audiences. It's more of a direct service. Journalism isn't just telling stories anymore.
Yeah.
And I think that is a big transition in what's going on. So it's cool that, and how many entities and how many people have jumped into that COVID-19 tracking world now?
Hundreds. It is a incredible, well-oiled machine that is primarily run on volunteers who dedicate their time to make this happen. We have hundreds of people who make this work possible, and it's truly heroic. It's
kind of, to me, thinking of well-oiled machine run by hundreds of volunteers, that seems like an oxymoron or something. but it works. I guess that there's probably a really good story to write about just that at some point.
Yeah, it's like the best case for group projects that you can imagine. Everybody does work and it works out well.
The thing that's amazing to me and fantastic about this project is not just that the founders stepped up, and not just that they attract out all these amazing volunteers, and not just that that it's working so well, but also that it kind of set a model for other volunteer groups to stand up and step into this information vacuum that I was talking about. That there have now been, over the course of the past year, 5 or 6 volunteer organizations that have taken on, what are the exit strategies? What are the vaccine dashboards look like? Some of those groups have now merged into new groups, but the degree to which organized volunteer action made a difference in how we kept track of this pandemic, and second, possibly how this pandemic rolled out. That's going to be a really important part of the history when we have a moment to look back.
Right. It's so weird living in history that just keeps on flowing, where it's not like an earthquake where it happens and it just, then you recognize the failures and the like. It's such a dynamic process with such long timelines. We'll get back to the vaccine questions specifically in a minute. And I wanted to highlight one other thing here, which is Marin's. Somehow you're, again, thinking about all the things that are happening that a journalist has to cover, and you dove in to let me share it here. Teaching.
Oh, what did I do?
Right, in the middle of doing all the other work you had to do through the Knight Center at the University of Texas, Austin. How did that come about? And we can talk about what's going to happen there next.
So the Knight Center for Journalism in the Americas, which is supported by the Knight Foundation, decided they are, I think, the largest provider of distributed and sort of self-run, asynchronous education for journalists. And they do courses, MOOCs through the year on a variety of topics. And they came to me last spring, which again feels like a century ago, and said, we're pretty clear. And at this point, this was March, so it was really early on. Possibly the first lockdown in New York had just begun. And they said, we think that this is going to be important. And we're pretty sure that the mass of journalists are not well informed on the issues that they're going to have to confront, however long this story takes. Can we do something about it? And what we ended up doing is a 4-week asynchronous course, simultaneously conducted in English, French, Spanish, and Portuguese, that eventually attracted almost 9,000 students. I think the final count was 161 countries. So that's most of the countries on the planet. And in that, the content was short lectures, Q&As with newsmakers, Q&As with journalists already covering the pandemic, and lots of background material for people to understand aspects of what they were probably going to be covering in the rest of the year. Supported by some discussion boards and a Facebook group, which is still ongoing, and a Telegram group, and I think a WhatsApp group, or multiple WhatsApp groups. that course was converted from a live asynchronous course to a completely self-directed course and was put in an additional couple of languages and lives on the Knight Journalism Courses website now. And we're going to do it again sometime in the next couple of months. I think we are still working out the final timing. We are going to do a MOOC specifically on vaccines and vaccination, so that as vaccination rolls out with different formulas in different countries, with different different expertise with regard to the logistics, the reporters who now have had a bit of experience in covering the pandemic, because they had to do that over the past year from whatever their background was, will now have to tackle with vaccination in whatever their locality is. And we hope to help them do that as this keeps going.
It's
amazing. There will be more to say about that as we get the promos up and get the materials lined up and get the calendar hardened. It's a little bit early to talk about it now.
Yeah, and so let's dive in a little bit on the problem as we see it, and I'm going to show a couple of examples, but we could start in right away. When you look around the web, day to day, hour by hour, what horrifies you the most? If you could, what are the things, the aspects of? We'll focus on vaccination that the media have really sort of stumbled on the most. What are the hardest aspects of that? Maybe Jessica first, and then Maren.
Yeah, I mean, I think from the very beginning, those of us who have been in public health and who have been involved in any sort of communication surrounding vaccines were saying this is going to be a concern in the future. As early as March, we were like, there will be hopefully a vaccine about this. And if we're not getting ahead of the communication, it's going to be a disaster. Because look at what happened even just on COVID-19 in general. We are still dealing and paying for the consequences of terrible science communication early on. The fact that there is still not consensus in the public about masks has a lot to do with the fact that we had conflicting messages early on. That lack of public trust, or that creation of mistrust, is a consequence of that. And I think right now we're dealing with the same thing, where we are planning for this enormous vaccine campaign, but not really planning for the necessary vaccine communications plan around that. And because of that, we're setting ourselves up for failure. There are a number of logical fallacies that people fall into when it comes to science and comes to vaccine science. And I think if and there's also a science to science communication. And so if we're not being precise from the headline to the lead to the body of the article, we're going to continue seeing this infodemic surrounding COVID-19 and the vaccines related to the virus.
Yeah, this Reuters story really, I think it bothered a lot of people, because that headline doesn't, of course, it completely avoids the context. And then it turns out it was built on an ABC News, like a local ABC story that got it better. At least they did in their subsequent, I don't know if they updated their headline, but you see here somewhere, oh, I can't see the link right now, but there was the headline on the local news was better than the headline on Reuters. It just feels like, I'm sure that makes your hackles prickle. And Maren, same for you?
So, a few smart people, like the folks at the COVID Tracking Project, were saying early on that there was a profound mismatch with the enormous amount of money we were spending to get the vaccines, which it is not a mistake that we spent that money, let me be clear. But we spent all the money on Operation Warp Speed, achieving the vaccines, and nothing on communicating about the vaccines, and pretty much nothing on the logistics of distributing them.
Yes.
And even less money than actually was intended, because some of the allotments to the states for creating the logistics to distribute the vaccine was held up in that last stimulus bill that it seems like it happened just a couple of days ago, but it's actually a couple of weeks, but should have happened months earlier than that. So all through the fall, I'm sure, I know I'm not the only journalist who had this experience. I was talking to people out in state health departments and local health departments and saying, what's it looking like? How are you doing building your reporting dashboards, your registries? What are you doing about recruiting vaccinators and vaccine sites and so forth? And they all kept saying, we do not have the funds to do this. Mm-hmm. We were promised money. The money is not here. We cannot hire people without money. We don't have in-house IT specialists who will build these vaccine registries for us, which are very important, to make sure that people get, not just to keep track of who got vaccinated, but to make sure that people get the second doses and get the appropriate second doses. And that, that is not a problem that should have taken us by surprise. And yet somehow now it has. So, as we look at the stories that are coming out now about how slow vaccination is, that contains within it actually a bunch of problems. Some is the apparent delay in getting as many doses as were promised out of the manufacturers. And some of it is the delay of getting the doses that have arrived to localities into people. But certainly that second half has to do with the lack of support, the lack of attention that was paid to logistics, and the lack of money that was spent on logistics at a time when we really could have gotten in front of the curve.
Yeah. Laurie Garrett was on here early in the year, not long after she had written a piece for The Lancet on the general deep underinvestment and communication capacity at all these agencies. It's just not, and it feels self-serving for someone who's focused on communication and sustainability like me, or perhaps for you guys, to be saying there needs to be more budget for communication around these emergent risks. But I think I can set that aside pretty objectively and say that it's a ridiculous gap. I think I remember at the time, this is in the spring, late spring, there were 6 people at World Health Organization actually it was a lower number, dealing with social media, like tracking the social media landscape, the infodemic, the extreme storm of misinformation around this virus. And it's like, when you think about that compared to that scale, it's horrifying, actually.
Yeah, it's the very unglamorous side of vaccine campaigns, right? It's the stuff that people don't want to talk about, but it's that last mile that actually is the life-saving part. Vaccines themselves don't save lives, vaccinations do. And the fact that we weren't taking it across the finish line, that we just started strolling and that last leg of the relay race is deeply troubling, but it was also predictable and preventable.
That's so interesting. God, that reminds me of what Thomas Boyeo said here a few weeks ago about the difference between tracking, between testing, COVID testing and tracing. That just leads you to the capacity to quarantine and isolate. Exactly. If you don't do those two things, none of that testing and tracing matters. So you're right. It's like, what's the actual impact? That's very tweetable. I'll have to tweet that later. Vaccines don't save lives. Vaccinations do. Hopefully, folks who are watching can share this live or later now. Let's focus a little on the one issue here that's really tough, and that the Kaiser Family Foundation, which was in Marin's story in Wired, they track the statistics on vaccine acceptance and suspicion. And there's a big issue with minority concerns with deep-rooted history, whether it's Tuskegee or the other historic racial and particularly Black abuses that have been related to how some medicine has advanced. How big a part of this is that, getting that level of granularity? It's not just like some general story about vaccines and getting people to feel comfortable generically. It's much more variegated.
So I think there's lots of problems nested within this big problem of our not communicating sufficiently on the vaccines or communicating early enough. And one of those nested problems has been understanding that it's not enough to just put out a press release or have a social media account for your state health department that announces where vaccines are going to be or aren't going to be, or that the vaccine has arrived and that the data shows it's safe. What's needed is varieties of engagement with communities, mostly face-to-face. There's a woman whom I interviewed for one of my Wired stories a month or two ago who is created a job for herself as a community health educator in the African-American community in Washington, D.C. And she literally goes out in her car, in her white coat with a big anatomical model, and she props it on the roof of her car. And she takes it apart and she explains things to people. And she is herself African-American. And that is a degree of, she also was a vaccine trial participant. And she did that specifically because she had a conversation with some of the people she normally talks to who were very hesitant about the vaccine. And she asked them what would make a difference. And they said, well, this is a Black person speaking, if I saw more Black people taking it or more Black people involved in the production of the vaccine, I would feel more comfortable. And so she stepped up and said, here, I am a Black woman and I am a scientist and I can make a difference by putting my face, attaching my face to this. But I regret that I can't remember who made this point sometime in the past couple of months, but while it is undoubtedly true that the Tuskegee syphilis study was a terrible thing, and that is a wound that has never really been fully dealt with. If we talk only about Tuskegee, we are on the verge of getting ourselves into trouble, because it's as though we're saying just there was this one study. Right. And if we could just deal with that one study and put that aside, then the problem of not adequately attending to the concerns of minority populations ought to be dealt with. And it's much more nuanced and much more complicated. And, we do not pay sufficient attention day after day after day to problems of discrimination and equity and inclusion for non-white populations, non-middle class populations encountering the healthcare system. And all of those are now coming back to bite us as we try to figure out how to get as many people as possible to take the vaccine.
Yeah.
By the way, sorry.
Go ahead.
Well, I was just going to say, Howard Frumkin was on here earlier. I was going to say earlier this year. I mean, last year, who a big prominent epidemiologist and public health official, former. He was talking about having a workforce be part of whatever the Biden administration produces as starting January 20th. That's big enough to have that face-to-face capacity for vaccine, whether it's vaccine acceptance and administration, or again on testing and tracing and isolation and quarantine. You've got to have people involved in that, and that's a lot of faces. It's a distributed network, and here we are in an economy that's still shattered, that needs jobs. So it feels like there's some potential there to have more people like the woman you just mentioned in your Wired piece.
Well, to betray how long I have been writing about public health, let's think about what it took to get people in the, let's say, late 80s, early 90s, to get the populace, we'll just focus on the United States, aware of the complexity of putting yourself at risk from HIV/AIDS, right? What that took was, it wasn't just press releases from public health departments or from the CDC, though those were important. Of course, there wasn't social media then. It was street teams and recruiting ministers to talk about it from their pulpits, and everything possible to be as granular as possible in to the places where people went. Having HIV testing in nightclubs. Yep. This is not exactly the same problem, but it's a problem that's as big and that needs to be mobilized as quickly. And not only do we still don't have the funding, the public health system doesn't have the funding to create all that right now, but also no one's even done the planning to figure out what the strategies are to advance those potential communication opportunities. Again, as Jessica said, a while ago, we are way late.
Yeah.
And Jessica, over to you in terms of that potential and also the urgency.
Yeah, I mean, I think from a communications perspective, it's important to remember that the vaccine hesitant or anti-vaccine community is not monolithic. There's diversity even among the diverse demographics, and for various reasons. And yes, it's not just Tuskegee or gynecological experiments on Black and brown bodies, or what happened in Puerto Rico with birth control. It's what COVID-19 has been revealing, that we have systemic racism that is putting communities of color at disproportionate burdens of this disease. And I think what's important to remember is that when you have communication plans, they can't be just from one source. They need to be, like Maren said, from a number of people, from, barbershop owners to religious leaders. And, there was actually a really great commentary that came out in the New England Journal of Medicine a few weeks ago that I thought was super helpful in kind of shifting the responsibility on this topic. And it was, instead of positioning this as communities of color don't trust the medical or pharmaceutical industries, it's that the medical and pharmaceutical industries are not trustworthy. And because that trust has been broken. So that shifts the responsibility on us, on the people in science, people in the medical and pharma space, to restore that trust, to rebuild it by doing things like putting people of color in positions of leadership, by being very, very diligent about recruitment and having diversity represented in clinical trials, and having, a lot of examples, not just for photo opportunities, of people of color, either promoting or taking the vaccine. And so, and also apologizing and speaking about the real trauma that's happened in the past. I think that a lot of people feel still very manipulated. And 2020 was a difficult year for people of color. I mean, every year is, but 2020 in particular was deeply disturbing. And I think because of that compounding trauma, the trustworthiness of the medical community has a lot of, repairing to do.
So let's get back into the press. What can the press do? And I think there's a lot more. I think as the Atlantic has demonstrated, the public service part can be big. The press also, unfortunately, is in a state of rapid implosion, both in terms of their capacity and budgets and finance, except for the New York Times and a few outliers. And that makes this all that much more tougher to think of the press as playing an important role, but they have to, right? That's what we do. I just want to look at New York Magazine. My friend David Wallace Wells, who had done that very powerful book on climate apocalypse, dove into COVID-19. I think he's done some really good work. But then at the same time, they just published this big story, 5,000, 6,000 word story that some find very problematic about the origins of the virus coming. Maybe it is a lab, which just feels like and you look at the piece, of course, and it's still mostly inferential, not concrete. So I don't know, does this feel like, again, a lost cause, or what do we do?
It can't be a lost cause. It really can't be, especially when we have science and data to specifically refute claims like this. It's what, to me, this shows is a complete disregard for science communication and just a desire for clicks and eyeballs. There's no sense to this except for money and, the kind of objectives of getting people to consume that information. And what's frustrating is that it exists and doesn't have a lot of consequences as far as like the journalism space or social media space. It can kind of exist, and all you need is just a flashy headline with a beautiful graphic for that to turn into a full-blown conspiracy and viral trend in social media. And
those reverberate for a long, long time. You're right. The accountability part is always playing catch up anyway. And Maren, you've been a magazine writer for a very long time, mostly. And I'm not saying magazines have a unique role here, but is there hope? What's the best case stuff that you see? And what's your perception of even this work?
So I think that over the past 24, 48 hours since this New York Magazine piece came out, a lot of reputable people have taken to social media to take it apart line by line. So I'm going to consign that task to them and not try to go over it. I will just point out that the very first line of the story it employs the phrase "I believe," which I do not think is something that is appropriate in evidence-based science journalism. And it is really disappointing to me that New York Magazine, with their massive platform, chose to go out with this piece that has been so incredibly resonant and has gotten such wide dissemination, and they could have made a different choice, and I wish they had. So I've been both a newspaper reporter and web reporter, and also a now mostly a magazine journalist. And one of the tasks of magazine journalism sort of takes on itself is to be sort of the contextualizer, the layer of the journalism market that kind of tells you what to think about things, as opposed to, for the most part, advancing the primary granular reporting. I think there are aspects of the magazine market that have done that really well this year. The Atlantic is a prime example.
Yeah.
We need more places like that. More places, I guess, that are backed by billionaires, so that they have the leisure to do things like that. As you said, Andy, one of the underlying problems with this is that the entire journalism market has been so undermined. And it's kind of weird to me, as someone who is a public health person and has been writing public health journalism for a long time, that the correspondences between what's been going on in journalism and what's been going on in public health. Because as we've talked about before, the public health system in the United States has been shockingly underfunded, and this may not make sense, but more and more underfunded. Like, the curve has been going down, and it is not just during the Trump administration. It's really at least since the 2008 recession and all through the Obama years. Funding for the public health establishment in the United States was sliding backward down the curve. And it's just about the period of time in which the budgets for, the journalism market was imploding, that the traditional sources of revenue were going away. And so, as public health has not been there to speak to the population, journalism hasn't been there to speak to the population either. Aside from I'm crossing my fingers for a change in the Biden administration for funding of public health. I'm not sure what we do about the funding on the journalism side.
Yeah, even just making the case for public health as a public good seems to be. I think there's more potential to make that case now than there ever had been, at least in our lifetimes. But I know all the conversations I had over 20 years with Kirk Smith at Berkeley, who is one of the fathers of the field of public health, looking at sanitation and smoke inhalation in developing countries. And he and others would always talk about, it's just hard to make a case for, well, there was another guy, Howard Koh, who used to be at Health and Human Services, once said to me, you go to a hearing and you're there talking about these statistics on deaths from inhaling coal-fired power plant pollution. And some congressman always says, show me the bodies. And it's all in the statistics. And so it's got that abstraction to it that makes it a hard thing. I think that's why you don't see it as a routine aspect of how we invest in stuff. I think that's a challenge for communication too. Mm-hmm. I want to show, you actually inspired me, Maren, to, I've made these signs off and on. Early on last year, the signal study syndrome sign I made when I was covering climate change, because you'd always see someone, either an advocate for climate concern or someone who's a skeptic, jump on the latest study on cosmic rays cause global warming, not CO2. And it would be one study. And I had the single model syndrome sign I started posting on my tweets sometimes, warning people when something was in the news about COVID-19 that was based on a new model. And I just, as you were speaking, I made one here. I believe. So as a news consumer or as an editor, when you see the words "I believe" in a story about something like this, that feels like it should have a big warning sign, or at least in our heads should be something that resonates. And that's why I want to leave here, these last 20 minutes or so, talking about the solution side of this for newsrooms, for editors. We're not going to build a news toolkit here today. But I think there's stuff we can talk about, at least that kind of gets at some norms and practices and things to watch for. So if you're building that curriculum for your spring course in vaccination, do you already have a rough sketch of what some of those little items would be like? Or is it still
so my spring course is going to be, it's going to be very much about the science and especially the logistics of vaccination, which is going to be very different in different parts of the world, right? And the audience for these courses is not just the United States. So, I have to keep assuming we get some of the same students back again, I have to think about what, the lone journalist in Nepal or in Mozambique or in Venezuela is going to be encountering as they try to cover vaccination there, which is going to be very different, I hope, than someone who's going to be covering vaccination in Bakersfield. There are going to be questions of are vaccines available? Have rich nations bought them all up already? Are different formulas going to emerge that are easier to transport? If not, how's the cold chain going to be maintained? What's the impact of working on, so hard to vaccinate against COVID? What's that going to do to existing public health programs around the world, to childhood vaccination, to the polio campaign, to nutrition campaigns, et cetera, et cetera, et cetera. What I'm hoping we're going to see now that we're amazingly into the second year of this is that, myself and a number of other public health journalists were saying repeatedly over the course of this past year that what we were seeing, and this was inevitable given the context, was how much public health was being covered by political reporters. And the frame for political reporting is just very different than it is for public health or for science reporting. And it would be really great to see the science reporters sent to the White House briefings. I mean, hopefully now we will again have HHS briefings and CDC briefings, as I said, there was one just this morning. So again, people with context, people who have background expertise will be able to translate what's going on for their readers and viewers, and it just doesn't all become horse race narrative.
God, just to be sure we're not too truncated here, I want to emphasize how resonant that is with covering climate change. Most of the coverage you see is framed around the politics. Trump said this, he's doing this. And most of it's strategic. 10 years ago, it was about the climate bill. And it's like, not what's in the climate bill, not what would the climate bill do for the climate. It was who's winning, who's losing. It's the strategy. And that isolation of the political news from expertise in newsrooms is still a big problem.
Yeah. I was going to respond to the banner idea that you had when it comes to seeing some of those headlines. That was especially on my mind early on in the pandemic when I was seeing the beginnings of coverage on mutations. And I'm specifically thinking of that infamous Los Angeles Times article that I think actually set the tone for a lot of the panic and confusion about mutations, and missed the opportunity to teach people really cool science about how absolutely normal it is for viruses to mutate, and how viruses mutate when they replicate, and they replicate when they infect new people. And so we can stop it by not spreading the disease. It was such an opportunity that was just beyond missed. It created a space for people to write as though we are dealing with Frankenstein type mutants from World War Z type stuff, and I think now that we're actually, dealing with the circulation of a couple variant strains, people are panicking, and they're asking the same questions that they were asking early on when these genomic sequences, the differences in the genomic sequences are being identified. And instead, and the banner makes me think of that was based on a preprint study, and preprint is a word that a lot of people didn't even know was a thing. Us in the science community, very familiar with preprint servers and preprint studies, and they're intended to help the science community to create a kind of ethos of collaboration and peer review. And the fact that there are still articles coming out without the banners and disclaimers, and I really think it should be a banner and or disclaimer on the top to say this is preprint, non-peer reviewed research. This is one study. This is whatever it is to kind of contextualize early on, even if it's, hey, this is an anecdotal report on one person's experience in one location. It just brings the urgency and the kind of hysteria that kind of usually comes with some of the headlines down several levels. I do a lot of my science communication on Instagram, actually, and Instagram has a number of different stickers that you can add to pieces that show whether it's misinformation. And let me see if I can share.
By the way, just before you do, I pulled up from Twitter one of my other warning labels, which is publicity before peer review. So yes, I agree with you completely on this, and I think it's doable. And I don't think it's like the media don't operate with like rules, but
Yeah.
norms are something we can work on. So what you did have an Instagram story to tell, yeah.
Yeah. So, when this happened with the New York Magazine, let me see if I can. Let's see. I'll do this screen. Oh, it's saying it's lost permission to capture my screen. Can you see my screen?
Yes, I do. Well, don't worry about that. Let me just pull up your Instagram account here, and we'll see if we can work it out. And we have a soundtrack. Just kidding. Hold on here. Stop sharing screen. And I appreciate everyone's time today. There's so much going on, not just the politics, but in your own lives. Hold on one second. Share screen.
I'm trying very hard to ignore the notifications from Congress. Right?
I know.
Turn my phone
Okay,
on.
here we go. So here's one. Oh yeah, there you go.
Exactly.
Oh, that's beautiful.
Yeah. So, and they've got all kinds of different stickers that you can add, whether it's, debunked, pseudoscience, misinformation alert. And I use them often because these things go viral, especially on Instagram, in seconds. I mean, misinformation travels faster and farther than actual data and science. And I think to add these kinds of labels, I mean, I receive feedback constantly of, oh my gosh, thank you, because I was, going down a rabbit hole of panic. I think another example of that is the situation in Los Angeles is extremely acute. But the way some of the headlines were talking about the directives that were given to paramedics made it sound like everybody is just, out dying on the street with no resuscitation efforts being made, and that no oxygen was going to be delivered. But instead, it just needed like the nuance and needed the explanation of what we're trying to avoid is people sitting in ambulances, and ambulance is not going to help other people. The same thing goes for the vaccine stuff. When people don't understand kind of the details of how mRNA works, and that mRNA simply cannot alter DNA because it doesn't even enter the nucleus, that kind of stuff gets lost in what people don't understand about basic science. And I think that sometimes it requires stickers and GIFs and banners to just calibrate everything.
That's actually really great. I'm so glad that you showed that. But kind of at the beginning of the year, before COVID, before everything kicked off, there was a Twitter account that attempted to sort of reduce the PR temperature on papers. It's called. I don't know if it's still operating, but it was called "Just Say in Mice." And whenever someone tweeted a paper, they would retweet it and say "in mice."
I love
that. Right? Because then you could just screenshot that conversation and send it on. But this is the simpler and the more graphical something is, the more impactful it is. So that's superb.
Well, at the very least, and for those who are not actively trying to disinform, it gives a cue, as Jessica was saying, just to hesitate, just that little second before you then propagate and amplify the issue.
And it's right there. It's right there in the social network. The International Fact-Checking Network at sometime in March or April stood up a coronavirus fact-checking alliance, which is fantastic. It's multilingual. It's supported by Pointer and a bunch of other places. And they have now a really extensive database of varieties of untruths and disinformation about coronavirus that they have debunked both generally and sort of for specific countries. The problem is you have to go to the database and look it up. So it's kind of like Snopes, you have to go.
Right. You have to be motivated.
It's true or not true. And to have something like that you can label and pass on and, insert back into the discourse really makes a difference.
I'm looking for that Just in Mice. Do you remember the account name?
I think it was the account was Just Say in Mice.
Just Say in Mice.
I've done a lot of like in vivo or in vitro in brackets. And I think it's amazing to see kind of people who don't have science backgrounds be able to say, oh, I realized this was not an in vivo study. This was an in vitro study. And so therefore it doesn't really apply right now to public health. And you can increase science literacy without having to dumb everything down. You don't have to speak down to people as though they can't understand. I love it. Just Say in Mice.
Yeah.
the kind of differences between something that is in a mouse model or actually in a clinical randomized control trial. Even just elevating the profile of the gold standard double-blinded randomized control trial has been huge. Now people understand that is necessary when we're talking about therapies. I mean, when hydroxychloroquine and even ivermectin were trending, a lot of people who didn't have that background in the beginning were able to say, but wait, where are the RCTs here? And could kind of step back and, realize that there might be some sensationalism here.
It's true. And what I like about several things we've just been talking about is that they can spread kind of virally too. If you create a culture, especially in young people, of not wanting to be fooled. And I think most young people don't want to be fooled, right? My 22-year-old son would really be pissed about that. So if we can kind of harvest that energy, it feels like a useful way to have a counter propagating wave. It'll never catch up with the disinformation, I think, but at least it can work to do more. This has been great so far. We have to, I know, Maren, you have to get off soon. So any last thoughts about where to go from here? I'd like to do another episode or two on this, keep the thread going. It's something that we've been digging at. And I can see already some potential to bring some other people on to
so the thing that
visual communicators, for example,
connected about this problem of communication is that the problem of communication and the problem of logistics are kind of coming together now, because the problem of communication isn't only big questions like, are the vaccines safe? Are the vaccines trustworthy? Are the vaccine makers indemnified against injury? It's also simple things like, I have a 65-year-old family member. Where do they get their vaccine? As everyone I think is aware, because of the challenges of both getting vaccine into states and then getting vaccine out from state health departments into vaccination locations, a lot of the states, which had been given some latitude to deviate from what the CDC advisory group recommendations were on prioritization, states are kind of changing their rules on the fly. So here in Georgia, where I live, they had the 1A, 1B, 1C prioritization, and they announced just a day or two ago that they're going to take everybody in like 1B and 1C and move them all into 1A. So anyone in Georgia who is 65 or older is now going to be eligible for a vaccine in the very first categorization. But they only said that in a press release on the Department of Public Health website, and they haven't yet been able to say where any of those people 65 years old or older can actually go to get the vaccines if they're not, for instance, a healthcare worker. And so that question of how do we get the granularity of that communication out to people wherever they're going to receive it, that's a really formidable challenge, and it's not being handled well now, and I don't know how we're going to solve it on the fly.
Yeah, nothing will happen on the fly. I think this is sort of a never-ending story, and that could feel really dispiriting and exhausting. But I think it just requires sustained engagement. Just get up in the morning. If you're an educator or a public health educator or a journalist, thinking about what you can do to at least build a community, spread these skills, deepen the skills, get newsrooms talking about new practices. And I just thank you, Jessica, for forwarding this account, Center for Countering Digital Hate. What they're showing here is that there's a really small community of these active super spreaders, essentially, of disinformation. It's not, it's like so many things, in life, whether it's terrorism or this kind of thing. There are ways to zoom in on really core bad actors, and then build that capacity.
It's important to remember that it's a loud minority, right? It's a loud minority, and even I was just going to say it's important to remember that it's a loud minority. And this loud minority has existed for a long, long time. I think right now, especially in the vaccine space, the fact that we're seeing that loud minority come up in healthcare workers, and with the story of what happened in Wisconsin with the pharmacists and a number of healthcare workers across the state, and even first responders like here in Los Angeles refusing the vaccine, it is a minority of people who have those positions, but it is deeply troubling because it's the stories that make the headlines. And I think there's also responsibility that needs to come, because what that does is create more distrust of, oh, if these people who should be kind of behind the science, or the ones who should be eager to take the vaccine, if they're not, I think that to give them, sometimes science communication requires knowing which stories not to tell, or just not to give a lot of attention to, because you end up breathing more life into them than they need. And this loud minority has been riding on a lot of the attention that they've been getting. And I think sometimes it could serve everybody if we ignored them.
Absolutely. Well, this has been a really good initial first of the year look at these issues as they relate to the vaccine push as well. And of course, that's going to be going on all year. The numbers are daunting, as Fauci and others have laid out. Whatever number you pick for herd immunity, it's clear that with a substantial part of the population resisting vaccination, including some healthcare workers, significant numbers, this is going to be a long haul ahead. A lot of work to be done by communicators of all kinds. It's great to have had you here today, Maren McKenna from Wired, and from your authorship of great books and everything else you do. Good luck with your next teaching episode. I'd like to help amplify that as much as we can.
I accept. Thank you very much.
Good. No, and you know, we're tied in pretty well with the Society of Environmental Journalists, the Earth Journalism Network, the Global Network, Solutions Journalism Network, which I think is involved with you guys. But we're happy to collaborate in any way. And Jessica, again, thank you so much for being on here, representing COVID-19 Tracking Project and your own work in public media of all kinds, spreading the gospel of eagerness to understand what's actually happening, and resisting the temptation we all feel sometimes to just react and click. The more we can do to build just that little moment of reflection into that process, the better off we'll be. Again, I'm Andy Revkin at the Earth Institute of Columbia. This is Sustain What? It's a global online conversation identifying solutions to the complicated, shape-shifting, and epic challenges of humanity's great acceleration. That's the surge we've been on these last 50 or 60 years. Of course, this virus has imposed a great pause on all of that, and we're trying desperately to get out of that and build forward a better world, not necessarily build back better. At Prime Focus is making sense of and getting the most out of the planet's fast-forward information environment. It's the one Earth system changing faster than the actual environment. It's able to do wondrous things, connecting us from a distance here and spreading good ideas, but it's also very problematic, distracting, and being abused. So lots of work to be done. This webcast is produced as part of my work building Columbia University's new Earth Institute initiative on communication and sustainability. As soon as we're done, share the broadcast you've been watching with others. These get archived immediately wherever you're watching, on LinkedIn, YouTube, Facebook, etc. And look at that distracting scrolling bar at the bottom for ways to get in touch with me about future episodes. Thank you all for being here today, especially my guests again. Have a good day, stay safe. And it looks like there's some signs this will be a better year to come. Let's work to keep it that way. Thank you for being here.
Thanks.